This is Lab Medicine Rounds, a curated podcast for physicians, laboratory professionals, and students. I'm your host, Justin Kreuter, a transfusion medicine pathologist and assistant professor of laboratory medicine and pathology at Mayo Clinic. Today, we're rounding with Dr. Douglas McMahon from the Allergy and Asthma Center of Minnesota in honor of May being National Asthma and Allergy Awareness Month. Dr. McMahon is a board certified in allergy and asthma doctor and is a frequent lecturer at national medical meetings for food allergies and asthma. He's also proud to have served as the director of outpatient allergy at the University of Minnesota for 4 years and the president of the Minnesota Allergy Society. He is also the only allergy-trained member of the Twin Cities Children's Asthma Committee, and he's a member of the Food Allergy and Anaphylaxis Network, Anaphylaxis and Food Allergy Association of Minnesota, Minnesota Medical Society, and the American Academy of Allergy, Asthma, and Immunology. So we're definitely joined by an expert to talk with us now on National Asthma and Allergy and Awareness Month. Thanks for joining us, Dr. McMahon.
Well, thanks for having me.
Well, it's awesome to have you here, and for our audience, I think we have quite a diverse audience that are listening and chime into this podcast. Since it's Allergy and Asthma Awareness Month, why is it maybe to take a beat and say why is it important for people to kind of recognize asthma and allergy to bring it front of mind?
Yeah, so asthma is something that's very important because unfortunately people die of asthma. A lot of people kind of think about asthma as, I have some troubles here or there, but people unfortunately die of asthma. So it's definitely something to take serious and to make sure you're under good control all the time because you never know when the exacerbation is going to be severe. But also, which is hits home to more people, is that asthma affects everyday quality of life. So I grew up with severe asthma, and that's kind of why I went into this field, is that they're just small activities that people don't even think about. Little kids sleeping over at a friend's house, going on a camping trip, playing sports. All these things can be impacted if you do have asthma. So it's important to be under really good control for that. And then allergic rhinitis. Allergic rhinitis is something that affects millions and millions of people, probably one of the most common disorders in the United States. And a lot of people right now are seeing it. Spring allergens, the tree pollens, some of the molds are really affecting people, and it just affects their quality of life where they're not sleeping well, having trouble with sinus infections, having to skip school, skip work, just uncomfortable because they're having a runny nose, sneezing, itchy eyes all the time, and so it's definitely impactful on people.
Well, I hadn't really considered about, and I appreciate you kind of bringing this front of mind, highlighting, both the, profound aspect that some patients can die from asthma, but then also impacting kind of the everyday, how this can really kind of impact those around me. I may not have this diagnosed, but maybe there might be other people around me that are affected. Maybe this is a good time for me to ask then, are there, maybe just for awareness, are there simple things that I might be able to do that makes it a little easier from people that may suffer from asthma and allergies around me?
Yeah, so one of the big ones is smoking. People that fortunately don't smoke in public places as much anymore, so that's a big one. One thing that's interesting that we are seeing that a lot of people probably don't think about is, how people are bringing their pets around a lot more places right now. On their airlines and, the shopping stores and all this. And people, they like their pets or they want emotional support animals, but they don't really think about the patients that are allergic to these animals. And some people have asthma that is flared by that. And so all of a sudden now you're inducing these responses. And so that's kind of an interesting thing that probably a lot of people don't even think about that have them.
Well, that's a great point. And I imagine, it sounds like it's probably independent of it might be an animal that is cleaned and healthy, but still can set off exacerbations in those around you. And so I guess that brings to mind of maybe just highlighting if you're going to bring an animal by to kind of talk with people first instead of the surprise.
Yeah, especially if you're going to be in some close quarters. Yeah, for sure.
So, transitioning, one of the things I wanted to ask you about, in kind of talking before this episode, uh, is to understand some of the newer oral immunotherapy options that are coming out. We thought this would be a great way to kind of update listeners in our community to something that seems very relevant to patients for asthma and allergy. Uh, what should our audience understand about these new oral immunotherapy options?
Yeah. So there's two different aspects of this. One is for environmental allergies, one is for food allergies. They both work on the same premise that giving small amounts of the allergen, if you start small enough over time, giving more and more and more, your body can alter the immune response. So basically, the Th2 response is what a lot of the people who have an allergic response are in this Th2 realm. And the notion is can we switch that back to, either a lower response or possibly a Th1 response? And so a lot of this seems to be actually the younger the patients are, the better it works because the immune system is probably more malleable at that time. And so what we're doing right now, I'll talk about the foods first, is we are doing a lot of food oral immunotherapy, where we are taking these patients with severe food allergies, basically life-threatening to, peanut, for example. We are giving them about 1/50,000th of a peanut orally, slowly increasing that over time. And it's pretty amazing. You can see the immune response pretty quickly, like this IgG4 increasing pretty quickly after taking it. And then you can see the IgE slowly coming down over time. And so you'll notice these levels are changing. And so this is something that is really on the horizon, newer therapies that we're doing. It works really well, especially the younger they are. It works in adults too, but definitely better in kids. And so, and then I could talk about environmental as well, but do you have some questions about the food
Yeah,
allergies?
I just want to hop in and maybe ask for our audience because people maybe a little bit, have a kind of a broad base of understanding. And as you're talking through Th1, Th2 response, just I was wondering if we could kind of paraphrase that for our listeners to kind of pick up. I guess, do you think it's fair to say that the body in some of our patients have learned to respond with this sort of allergic anaphylaxis response. And with this strategy of giving small doses over long periods of time is kind of reprogramming that response so it does not respond in that way?
Yes, basically. So IgE is, so you can think of the like Th2 arm. We really don't need the Th2 arm anymore, and it's a hyperimmune response, the IgE, and but unfortunately, some people are starting off at a young age going that route. I mean, we have theories, hypotheses, why they're going that way. Some genetic, some other exposures possibly, but if they're starting to veer off that way, can we decrease that allergic response? And it looks like possibly we are, at least for the foods, um, able to kind of revert that strong allergic response back to a kind of a more normalized response. And so that's kind of
Well,
what this oral immunotherapy is.
excellent. And is there anything else that needs to be given to kind of reprogram that response, or is it just kind of the frequent low dose that seems to allow the body to have a reset?
Yep. Frequent low dose with increasing amounts. So eventually you get up to a higher amount. But yeah, I mean, there's people who looked at studies. Do you need to add other things? There was initial some data, some herbal supplements maybe helped, but subsequent studies haven't shown that to be beneficial. People are looking at other factors with it.
Wow. So this sounds like something, and I know we're going to transition to talk about environmental antigens in a second, but this sounds like something that, unlike a lot of times we read about new advancements that are being made, it sounds like, it's like stuff that is very, very costly. Access to this is very limited. Are some of these same challenges true when you're talking about these kinds of therapies?
Yeah, so
Mm.
interestingly, so the FDA, needs to review things to see, are these safe and everything. And the FDA process is long and it's expensive. And so companies need to recuperate those costs. So a company studied peanut flour through processes and they market it now called Palforzia. And so I was actually on the advisory board of them, and myself and some other doctors, we say, well, why are these patients paying $1,000 when this is just peanut flour? You know, and some people want that prepackaged flour. You know, we can measure it ourselves a small amount, but some institutions only allow FDA approved products, and so they need that prepackaged dose. And so some people will go through this for peanut called Palforzia. Expensive, but it works. But or you can do what we measure out the doses.
Mm. Now, if as we transition to environmental antigens or allergies, is it very similar story, or is it more problematic because we maybe have less control over our environment than what we eat?
Yeah, so the food allergens, it's pretty, I mean, you can see clear as day, a patient, we challenge them to you know, 1 milliliter of milk and they have anaphylaxis. And we give them these small amounts, and after 6 months, they're drinking a glass of milk. We can see them in front of our face, say, hey, wow, you're fine, you can go eat ice cream, you can go eat cheese pizza, you do what you want, whereas environmental is, it's different. People have, they sneeze, itchy eyes. We can't, we can somewhat see it, but it's not, you know, black and white difference we can see with that. So with the environmental, it's something called sublingual immunotherapy is typically what is done with the oral route. So same concept, but basically giving small amounts of the food, or no, sorry, the environmental pollen, animal, dust mite under the tongue. So there's a couple options to do. Some companies have made them for dust mite, a tablet called Odactra, 2 GRAS tablets, GRAS Tech and Oral Air, and then a ragweed tablet, Ragwitech. Or you could go to some special compounding pharmacies like our facility, or there's other ones that do compound these, and you can get them underneath the tongue and do those at home. They work well, normally reduce symptoms by about, depending on what study you look at, maybe 50% reduction of symptoms. So it's not, 100%. But
And what's the Venn diagram look like if we're talking about people that have allergies to food allergens and then people that have allergies to environmental? Is that pretty overlapping, or is that kind of more of a
yes,
separate?
seems to be like eczema seems to be possibly like the middle starting point of those. A lot of kids have eczema, and we
So
think
dry skin?
dry, open, rough skin.
Mm.
We think because it all starts with that, maybe these allergens, food and environmental, are coming through that skin, inciting this Th2 process that's starting this allergic pathway is kind of where we think. And so that's why we always try to tell these patients with eczema, try to get a real good skin barrier early, prevent that. But there's some patients that have no eczema and all of a sudden get environmental allergies, get food allergies, get asthma. But I mean, my specialty is asthma, environmental allergies, food allergies, and eczema. And I see a lot of patients with all of it.
Mm.
A lot of patients have more than one of them. Not everybody, but a lot of them have a couple of those conditions together.
And is your treating one, is it a true statement to say, like, if I have a milk allergy and you're desensitizing the or retraining my Th2 response, and I also have other allergies, like maybe environmental allergies, d is there a cross talk there where I'm kind of decreasing my overall Th2 allergic response, or is this something that the
Yeah.
body has to learn, like, per allergen?
So it's a good question. Typically for the foods, it's per allergen.
Mm.
Interesting though, along that line, so allergy shots have been around for over 100 years. And the same concept, give an injection of a little bit of what you're allergic to for environment allergens, not for foods, but environment allergens. Give a little bit, more. In the United States, we typically try to find everything you're allergic to, like Timothy grass, short ragweed, birch, and we put that in the shots, and then you get shots of those. However, what I hear is in Europe, they just say, okay, you're allergic to 30 things. We're going to put the 5 major things in because your overall allergic response is going to drop.
Mm.
So there's definitely some data that shows, yeah, your total overall allergic response is going to drop, even if you don't target those for environmental, but foods, we aren't seeing that right now.
Well, it's interesting to see that separation.
Mhm.
I really appreciate you highlighting this for our audience. And as you know, we have a strong number of audience members that are joining us from the lab medicine perspective.
Mhm.
And this podcast is really about kind of creating these bridges and helping laboratory medicine and the clinical practice sort of understand how each other works. And I was wondering if you might share, maybe some ways that in your practice you rely upon or use lab testing to support the care of your patients.
Mhm. Yeah. So one big thing is there's a condition called oral allergy syndrome, otherwise known as food pollen syndrome. It's very common. I guarantee you that some people listening here have it. I have it myself. People probably have it and they didn't even realize it, but it basically is people who eat like raw apples or raw carrots, raw celery, raw cherries, and they eat them and their mouth kind of itches, or they might get a little bit of swelling of their tongue or their lips, or maybe a few hives. And the next time they eat it, they don't notice it. And then the next time they do. And so they're very confused and they're saying, what is going on with this? And normally what that is the way I explain it is if people are allergic to certain pollens, if you looked under a microscope at those pollens, they have certain molecules in them. In those fruits and vegetables, they also have the exact same molecules in them. And because of that, then your body is saying, hey, you just ate some pollen and caused the itchy mouth. But the molecules are weaker. And so when the acid in the stomach breaks them down, you don't have those full body reactions. And also cooking it. So somebody might eat like applesauce and they're fine, but a raw apple, they have problems. And so interestingly, the lab is very helpful in telling this. It's called component testing. So we can do IgE component testing, which is very useful in helping us identify whether these reactions would be severe or not. Particularly peanut and tree nut is a big one, where patients come in and they say, I've never had a peanut, and all of a sudden I had it, and my lip felt funny. My tongue things was swelling, and we say, okay, can we tell? Can we tell if that is going to be a severe reaction or not? And yes, we can through the lab medicine. And so you can do those tests.
Phenomenal. So you don't have to actually expose somebody to it again. You can kind of, I guess, look in a more safe way, it sounds like.
Yes, there is. Speaking of that, I have not done much of this, but there is a lab test called a basophil activation test, BAT. Only certain labs have it, but basically, it's basically supposed to see if a patient would have a severe reaction to a food. So let's say you did a IgE to egg, egg4 level was 0.45, and you say, gosh, I don't really want to challenge this kid. This kid is not a very healthy kid. I don't really want to challenge him, but I don't want to make all these avoidance. There is a way to do this where you basically mix the patient's blood with the food antigen, and you can see if these basophils are activated. I know only certain places have that test, but that is something that's probably going to become more useful as the studies go on to see how beneficial this test is.
Yeah, it's wonderful to see and to highlight for our listeners. I want to kind of close out this interview, maybe just asking, again, in recognition of this being Asthma and Allergy Month, like, what do you think what's just over the horizon in your field? Like, in other words, how do you think you'll be practicing differently in 10 years?
Yes. So the biologics medicine, all the monoclonal antibodies is really taking over our space. Very targeted medicine, and so lab medicine will be useful in that aspect. In that we need to find which are the biomarkers that we're targeting, and so I think that's really going to continue to be the wave of the future.
That's awesome to hear. And I mean, yeah, absolutely, that's something that we're familiar with in laboratory medicine and how we think about different interferences or what does that mean for the other tests that we're looking at and measuring. So thanks for rounding with us, Dr. McMahon.
You're welcome.
And thank you to listeners for joining us today. We invite you to share your thoughts and suggestions via email. Please direct any suggestions to mcleducation@mayo.edu and reference this podcast. If you've enjoyed Lab Medicine Rounds, please subscribe. And until our next rounds together, we encourage you to continue to connect lab medicine and the clinical practice through insightful conversations.